Hi there. We are here today with Dr. Timothy Speicher of the Positional Release Therapy Institute. Tell me a story of a successful patient treatment.
When I was asked to kind of recant a few successful patients, I went through the mind Rolodex of the last 10,000. And obviously the ones that, kind of really pull on your heartstrings are the ones that kind of come to the surface quickly. But, we had tons of testimonials, of course, changed people's lives. But, the one that is the most recent to me that was really impactful was a young man. He was 38 years old. He's a airline mechanic, while doing the best he can at it, really. 38 years of intractable left scrotal pain, okay, since he's been age 8. To the point, it got so bad where they put him on morphine at a young age. Also, he had it removed, had nerve burned, cut out, had everything done known to modern Western therapy. Even he had acupuncture and stuff like that too. But he had everything. And I'm not quite sure how his mother found us, but we were his last ditch stop. I mean, he was contemplating suicide. Pain was that bad. Living in his parents' basement, taking 100 morphine pills a month, opiate addict now. And she had to convince him. She's like, I heard this guy's, this institute, I heard they do really cool things. Why don't you just try it? And when he came to me, I had real doubts. Like, I didn't know I was going to be able to help him. I mean, I'm like, all right, well, let's give it a shot and see what happens, right? And he did. He had a very specific pelvic issue that was never picked up, and he had seen everybody: PTs, ATs, chiropractors, physicians, DOs. I mean, you name it. Fortunately, we were able to identify it. I treated him with the wheelhouse protocol, and in 3 visits, he no longer had pain. So he was at 20 out of 10 pain all the time, sweating, just really anguish. He no longer has pain, which is a great thing all by itself. But even better, in a matter of a few months, we were able to reduce his opiate usage by half. So he went down to 50 morphine pills a month. He still has some, work up here to do for his opiate addiction. But that was I think that was a real win for us. That was a real eye opener, and obviously for him and his family as a whole. Not to mention the people flying his aircraft that he's fixing, right? So that's one of our most recent ones that is quite dramatic. But we have thousands, from athletes, from Olympic to your high school athlete to your 85. Recently, we had an 85-year-old man, recreation athlete, hadn't been able to run for 40 years, fixed him, and he's now running competitively. So, I can't say we fix them all, nobody ever does, but we fix a lot of people with positional release therapy. And even if the positional release therapy doesn't do it, it opens the door for other therapies to be more effective. Because if you're all bound up and wound up like this, how effective is exercise going to be if you're all wound up like that versus now you move like that?